Today, I want to update you about a rise in parasite-borne illnesses like heartworm disease and Lyme disease. Recent data from the Companion Animal Parasite Council shows that these diseases have been increasing across the United States. Even mostly indoor pets can be exposed. All it takes is one mosquito slipping indoors or one tick hitching a ride on your pant leg for your furry friend to end up with more than just an itch. In this video, we'll highlight which U.S. states saw the most significant increase in heartworm and Lyme disease in 2024 and go over the symptoms in both dogs and cats. Before we dive in, just a quick reminder. If you're new here, consider subscribing for more pet health updates. Now let's start with heartworm disease in our canine and feline companions. Mosquitoes transmit heartworm larvae to pets with just one bite. Heartworm disease is spread by mosquitoes and poses a serious threat to both dogs and cats. When an infected mosquito bites a pet, it can deposit tiny heartworm larvae, which then grow into long worms in the animal's heart and lungs. Let's look at what the latest data is telling us about what signs you should watch for in your pets. Heartworm in dogs. Last year's Companion Animal Parasite Council data revealed some hotspots for canine heartworm. Mississippi had the highest infection rate with roughly 1 in 15 dogs there testing positive for heartworm. Louisiana, Alabama, and Arkansas weren't far behind with about 1 in 30 dogs testing positive in each of these states. In addition, cases are rising in Texas, South Carolina, and Georgia, which have historically had high heartworm activity as well. This means if you live in these regions or even if you travel through them with your dog, heartworm prevention is more important than ever. But heartworm disease is spreading everywhere, so it's important to protect your dog if your area is impacted. Now, what exactly does heartworm disease do to a dog? As the worms grow, they damage the heart, lungs, and blood vessels. Symptoms of heartworm disease in dogs can be easy to miss at first. Many dogs don't show any signs until the disease is advanced. When symptoms do occur, you might notice coughing, like a mild persistent cough, difficulty breathing, shortness of breath, especially after activity, fatigue or exercise intolerance, weight loss or decreased appetite. Some dogs may just seem a little bit more lethargic than usual, which can be mistaken for aging or just being lazy. As the infection progresses and the worm burden increases, more severe signs like a swollen belly from heart failure or collapse can occur. The important thing to remember is that dogs typically go through stages with heartworm disease, from no symptoms to mild symptoms like cough, and eventually to serious heart and lung complications if not treated. This gradual progression is why regular annual testing is crucial. You want to catch it early before irreversible damage is done, and there is treatment available, but the more advanced the disease is, the harder it is to treat. What about heartworm in cats? You might be thinking, do cats get heartworms too? The answer is yes. Although heartworm disease is less common in cats, it can still happen with just a single mosquito bite. Cats are not a natural host for heartworms, so the worms don't thrive as well, but even a few can cause big problems. In 2024, states like Texas, Mississippi, Alabama, and Louisiana reported higher rates of feline heartworm. About 1 in 200 cats tested positive in these states. That's a significant number when you consider that the U.S. on average, only 1 in 500 cats test positive annually. It shows that in certain areas, cats face a relatively higher risk than what we used to think. Now, cats and heartworms are a tricky combination. In many cases, cats show very vague or even no symptoms at all with heartworm infection. Cats tend to be more resistant. Their immune system often attacks and kills the young worms before they mature. This means a cat might only end up with 1 or 2 adult worms, or sometimes none. However, resistant doesn't mean safe. Cats usually can suffer more severe reactions to heartworms. Often, the first signs in cats are things like vomiting. Even if they don't have worms in the intestines, heartworms can cause intermittent vomiting. It can cause coughing or wheezing and other breathing difficulties, lethargy or reduced appetite, weight loss, or just not thriving over time. These symptoms are pretty nonspecific and can mimic other cat illnesses like asthma or hairballs. Some cats might just have occasional coughing fits or vomiting and otherwise act normally. Here's the scary part. A cat can have heartworms with absolutely no warning signs and then suddenly collapse or even die from it. Cats often don't show the classic heart failure signs that we see in dogs. In fact, A cat can seemingly clear the infection on its own, their immune system might kill off the worms, but the inflammatory reaction itself can be deadly, or a single dying worm can trigger a fatal respiratory crisis. As a vet, I've seen cases where a cat passed away suddenly and a post-mortem examination found a heartworm that no one even knew was there. So even though cats are less likely to get heartworms, if they do get it, the outcome can be very serious. In summary, dogs and cats differ when it comes to heartworm. Dogs are the natural hosts, so heartworms grow and reproduce freely, even causing a long-term progressive illness with a large number of worms if untreated. They might go through an asymptomatic phase into mild symptoms and then severe disease over time. Cats are atypical hosts. They often only get a few worms or none at all because their body fights them off. But if a worm does survive, a cat's reaction can be sudden and severe, even causing sudden death with no prior signs. There is no safe adulticide treatment for cats like there is in dogs, so prevention is truly the best and only medicine for cats. No matter where you live, heartworm prevention, talk to your veterinarian, is absolutely essential. We'll talk more about prevention in a moment, but first let's switch gears to another big threat, Lyme disease. Unlike heartworms, which come from mosquitoes, Lyme disease is transmitted by ticks. Ticks are those little blood-sucking arachnids that hide in tall grass, woods, or even your backyard. When a tick bites and latches on, it can transmit Borrelia burgdorferi, the bacteria that causes Lyme disease. Once the tick is attached, it takes 24 to 48 hours to cause an infection. Dogs are much more likely to get Lyme disease than cats for reasons we'll discuss, but it's a concern for both pets and people in many areas. Let's break down where Lyme disease is surging and what it looks like in our animals. Lyme disease in dogs. In dogs, Lyme disease is the most common tick-borne illness we see. And according to the 2024 data, it's on the rise in several regions. The highest rates were seen in West Virginia, where about 1 in 6 dogs tested positive for Lyme. Next on the list were states in the Northeast, Vermont, Maine, and Connecticut, with roughly 1 in 8 dogs testing positive. Close behind were Pennsylvania, Massachusetts, and New Hampshire, with about 1 in 10 dogs testing positive. If you're in these areas, you should assume that a lot of ticks around you carry Lyme. But remember, Lyme has been expanding its range, so pet owners in other states should stay vigilant too. Cases have been spreading into the Midwest and elsewhere in recent years. So what should you watch for in your dog? Lyme disease symptoms in dogs can be somewhat subtle at first, or easily confused with other issues like arthritis. Common signs include limping or lameness, lethargy, loss of appetite, and fever. Often dogs with Lyme disease just seem generally unwell, have low energy, and perhaps some achy joints. You might notice your dog walking stiffly. One person described it as walking on eggshells, or not wanting to jump, not wanting to climb stairs. One tricky thing is that these signs might not appear until weeks after a tick bite, and they may come and go. Lyme disease can also sometimes cause more serious complications in dogs if left untreated. It can affect the kidneys and cause chronic Lyme-associated nephritis. It can also cause heart and neurological problems, but these are much less common. The key point, if your dog has been in tick country and later starts limping or acting painful in different legs, or just isn't themselves, it's worth getting a Lyme test at the vet and discussing treatment. Now, what about cats? You may have noticed the data from the Companion Animal Parasite Council didn't mention Lyme in cats. That's because Lyme disease in cats is extremely rare. We hardly ever diagnose it in feline patients. Experiments have shown cats can become infected with the Lyme bacteria, but for some reason, cats seem to fight it off, or just it doesn't make them visibly sick in most cases. There's actually no well-documented natural case of clinical Lyme disease in cats in the field. If a cat does show signs, they would likely be similar to dogs, perhaps fever, lethargy, and lameness, or breathing trouble. But again, it's uncommon for cats to get sick from Lyme. This doesn't mean cats can't carry ticks. They certainly can bring ticks into your home, even if your cat isn't falling ill. So you still want to use tick prevention tactics on your cats because they can bring ticks home to you, and they're also susceptible to some other tick-borne diseases that I'm not covering here. To summarize, Lyme disease in dogs. They're at high risk in many regions and it's spreading. Symptoms in dogs often involve joint pain and tiredness. Cats have a natural resistance to Lyme and rarely become ill from it. You should still keep ticks off your pets for their comfort and health. Now that we've covered the diseases and what to look for, let's talk about prevention and action. The good news is both heartworm and Lyme disease are largely preventable with the right measures. Here's what you should do as a responsible pet owner. Talk to your veterinarian about preventive medications. For heartworms, there's chewable pills, topical treatments, or injections that kill off any heartworm larvae before they mature. These are typically given monthly. Don't skip doses in areas where there's mosquitoes. It takes one bite to infect an unprotected pet. For ticks, get a recommendation from your veterinarian, as some dogs are predisposed to neurological diseases like seizures and can be susceptible to them. Be sure to check for ticks after walks and use natural repellents like essential oils. We'll link to a video on how to make one. Follow your veterinarian's recommendations for testing and checkups. At least once a year, have your dog tested for heartworms. This is a simple test your vet does. Many vets also recommend an annual tick-borne disease screen for dogs, especially in high-risk areas, which checks for Lyme, Ehrlichia, and Anaplasma. Cats can be tested for heartworms too if there's any suspicion. Early detection can save your pet's life or health. Since we can treat heartworms in dogs, if we catch it early before it causes too much damage, they can recover. There is no treatment to kill adult heartworm in cats, unfortunately, which is why prevention in cats is important. Know the symptoms and act quickly. As we discussed, if you notice possible symptoms of heartworm or Lyme, don't wait. Visit your veterinarian. The sooner we diagnose these diseases, the better the outcome. Lyme disease in dogs, for example, is treated with antibiotics, and most dogs improve quickly if treated early. Heartworm disease is much more complicated to treat. It's so easy to prevent, but the drugs used to treat it are just really hard on dogs, so prevention is a way to go. So catching it early is safer for the dog, and you don't want to end up having to treat an advanced case. Protect your home and yard. Keep your yard trimmed to make it less hospitable to ticks. Consider using pet-safe yard treatments if you live in a tick-heavy environment. For mosquitoes, the heartworm vector, eliminate standing water around your home so they have fewer places to breed. Using window screens and keeping pets indoors at peak mosquito times can help a bit. Though remember, mosquitoes can sneak inside. Indoor-only cats are still at risk if a mosquito gets into the house. Speak with your veterinarian about what prevention is right for your pet. There's no one-size-fits-all. Factors like your location, your pet's lifestyle, and health status all matter. Your vet might also recommend a Lyme disease vaccination for your dog if you live in or travel in a high-risk area. Yes, there's a Lyme vaccine for dogs, though not for cats. I'm not sure if you should definitely discuss that with your veterinarian, because I do know when it first came out, there were a number of dogs that had reactions to it. But it's worth considering in certain areas where Lyme is rampant. Before we wrap up, it's important to note that these diseases don't just affect pets. Some can affect humans too. If you have dogs or outdoor cats, you and your family are sharing the same environment that harbors ticks and mosquitoes. For example, Lyme disease is a well-known illness in people. It can cause fever, fatigue, joint pain, and the classic bull-eye rash in humans. So if Lyme is on the rise in your area, that means humans are at risk from tick bites as well. Dogs aren't directly giving it to you, but the ticks they carry could bite you. Another disease, anaplasmosis, which is carried by the same ticks that spread Lyme, is also a growing concern. In states like Maine and Vermont, up to 1 in 3 dogs tested positive for anaplasmosis last year. That's a huge number, and yes, anaplasmosis can affect people too. It causes flu-like symptoms in humans. The takeaway here is that protecting your pets from ticks isn't just about them. It also helps protect your family. If your dog is on effective tick prevention, they're less likely to bring ticks into your home or yard that could end up biting you. Also, practice good tick safety. Use repellents on yourself when hiking, do tick checks on your pets and children after outdoor activities, and remove any ticks promptly and safely. Remember, you have 24 to 48 hours before ticks can transmit the disease, so you want to do this that day. And of course, if you get any strange rash or illness after a tick bite, see your doctor. We're all in this fight against ticks and mosquitoes and their diseases together. To recap, heartworm and Lyme disease are on the rise in many parts of the country. Heartworm's a deadly mosquito-borne parasite that can infect both dogs and cats, with the highest rate of infection in states like Mississippi and big increases in the southeast. Lyme disease is spreading via ticks, with major hotspots in the northeast. The best thing you can do is to prevent what you can and stay informed. Work with your veterinarian on a plan that keeps your pet safe from parasites. And don't forget, what's good for your pet is good for you and your family too. If you found this information helpful, please give this video a thumbs up and subscribe to our channel. By doing so, you'll help us spread awareness to other pet owners about these important health issues. Share this video with friends, especially in high-risk areas, so we can all keep our furry family members healthy and happy. Thank you for watching, and I'll see you in the next video. Stay safe and keep those pets protected.